everybody. This is Megan Antonelli, and we are here for the Digital Health Talks 5 Good Things segment. It is June. Happy summer. Happy summer, Janae.
Thank you. Happy summer to you. I am ready for school to start again.
Oh, me too. Me too. This month's 5 Good Things is for healthcare leaders who are tired of being sold the magic, because yes, a lot of digital health news still sounds like AI is coming to save everybody by next Tuesday. But underneath the noise, there was some actually encouraging June stories. Took us a while to find them, as it always does, but here we have it.
Yes. And as always, we would love to hear your stories. We're always happy to share people's stories, and we love to hear good news. All right, let's start 5 good things with something for women.
Good idea. So early this month, it actually feels like it was like 6 weeks ago, if you ask me. Melinda French Gates donated $215 million from her group Pivotal to women's health. And sort of that is an unbelievable amount, and it's very exciting to see. And there's a lot to where the money is going to go, I think. I think there's some partners like Welcome Leap and the Menopause Society that are getting support from it. But, and she's been a long time supporter of women's health, but exciting to see $215 million.
Yes. And I think it's important to note that this isn't the first time. Like, I think she's invested maybe $600 million so far, and has committed to invest at least $1 billion in supporting women's rights and women's health. And frankly, women need it.
Yes. So, in addition to menopause, the money is focused on also protecting care during reproductive years, expanding the focus on midlife as well as menopause, and lots of money also international, like for HealthIMPACT, which has a focus on Africa.
Yes.
So,
and I think too, that's really timely when we look at the news that women live in poor health for 25% more of their lives than men. And I like what she said here. With greater focus and funding, we can stop asking women to simply live with poor health and start delivering the solutions they need. Like, stop asking women to just put up and shut up, and start telling women they can expect to have a great life. And that should be the expectation. Not that, during this period, whether that be when you have a child, when you try to go back to work with your child, when you're going through menopause, so much of women's lives, including women from healthcare providers, is someone telling them that that's just how it is. When you're pregnant and puking, that's just how it is. When you're having hot flashes, that's just how it is. Like, just stop. Let's just try to make it better instead of telling people that's just how it is. So I like also when people say things can be better and put their money where their mouth is.
Definitely. Congratulations to her, and thank you for the support. And now to our next good thing.
Yes. And also Melinda can come speak at our conference. That's my official invite.
Okay. Well, this one from our friends over in England, the NHS, they announced the results of a study where they were able to recover quite a few hours, and therefore are moving forward, and they are putting AI in the hands of 500,000 staff members because they really saw an impact, which we like to hear about. I think it was Microsoft Copilot, and they reduced administrative burden and freed up an average of 2 days per month of admin duties for their clinicians, giving more time for patient-facing work. So good to hear about that happening, working. We hear a lot about these ambient tools and, reduction of predominant time, but we're glad to hear that they were able to really measure it on that scale. And, ultimately it's something that is moving from pilot to practice, if you will. And so good stuff happening overseas.
That is great news. We love the NHS, and we love reducing burden. Let's talk about the number 2 thing, because the Centers for Medicare and Medicaid Services Office of Health Technology and Products has been established. That was established on June 9th, 2026 under HHS. And I do want to say that some of the most innovative things in healthcare have come through CMS. They have had innovation just historically. And so I'm really looking forward to that.
Over there.
Yeah.
Busy, busy, busy. Lots of announcements coming out of there.
So they'll be talking about governance, cybersecurity, enterprise architecture, capital planning, and investment control responsibilities, as well as CIO-led digital service delivery, customer experience, and public digital experience responsibilities under applicable law. And I think that's going to really help people be able to access and understand benefits better and decrease some burden. So I thought that was great news.
Yeah, it's interesting. I mean, it's sort of surprising that they haven't had it, but I guess it's, where do these things sit and where do we add? And, who kind of takes responsibility for evaluating some of these tools that are being used. So good stuff. There's been a lot of conversation. Peterson Health Institute has released a number of studies around, what the payers are doing. And obviously CMS being the biggest, it's good to see them, kind of putting structure around this, because I have always felt that the commercial markets tend to follow CMS. So when they pay attention, everybody else does.
Yes. And I think it's also good that they're treating digital health and some of these infrastructure issues as more of a core public health infrastructure and less like something special.
Mm-hmm. Mm-hmm.
And it's also a signal to health system CIOs and to everyone that federal health technology is going to lead in this area, where before I don't think they really did lead in modernization.
Right. No, for sure. We're starting to move much faster. Now, the next one, also from England, I guess, with Health Europe happening this past week, I guess
I think you just got these because of soccer. You've been watching soccer, and this is what came up in your feed now.
It is all about the algorithm, isn't it?
Can we also talk about the good news of people sharing their stories of the U.S. online? Because that's been my good news minute. In all reality, watching people come visit is thrilling. They love Taco Bell. Don't love healthcare.
They love ranch. Maybe not best for healthcare.
Yes.
But NHS leaders say the future of care may be digital first. So we've been saying that a long time. They talked about kind of integration. I think this was Dr. Penny Dash, also NIH England, talking about kind of the future of where more care is delivered through smartphones, obviously improving access, AI-supported pathways, robotics. And, I think what's good is that they're not saying, doctors aren't going to be needed. They're just saying that this digital first pathway allows for better access, better equity, easier, kind of workflows and training modules, and, kind of getting the friction from the healthcare experience. So more people doing it and taking better care of themselves. So interesting story out of there and good stuff.
I love that too, because it also accounts for the fact that people are going to be using their smartphones to access healthcare information. Dr. Google is a phrase for a reason. People are looking for care on their phones. So I like that they are acknowledging the reality that smartphones are here to stay and that we need to give people care there. We might as well bring great robotics insights and other things to phones in addition to just strange Reddit threads.
Yeah, it's really about meeting them where they are, right?
Right. All right, let's talk about another thing that we love, which is caution and security. UCLA announced on June 11th that they're launching a research-driven center of excellence focused on evaluating AI safety and implementation in healthcare. So the Innovai Center will focus on...
Let's spell it for everybody.
INOVAI. But what they did do is they tried to protect patients from bad implementations. And
it stands for, wait, hold on. It stands for Innovations and Outcomes Validation of AI. Wow. It's like a valid AI group, Innov AI Center. Fantastic. And it's Janae Sharp, who is in the press release, at least quoted, speaking about it, talking about how it will address one of the most important gaps in healthcare AI, knowing whether these tools are safe. So
I think that's so important, because if people just go thinking every tool is equal, that's when we get issues. That's when you see hallucinations happening. That's when real dangerous outcomes can happen. They'll be looking at evaluation across the life cycle of it: usability, feasibility, workflow assessment, clinical trials, and implementation.
Yeah. And heads of it are Dr. Paul Lukacs. He's UCLA Health Chief of AI Officer, and Dr. John Maffei, who is professor of medicine, and they are co-directors. So, they're doing a lot of work. They're looking at AI scribes. They found that there was a significant reduction in time spent writing clinical notes, and also revealing this I haven't heard much before, but improvements in physicians' cognitive load and work exhaustion and overall well-being. And, the exhaustion thing can't be overstated, because I'm feeling pretty exhausted by all of this conversation around AI myself. Even though I love it and I use it, it is exhausting.
I think they also had a report that said that the number of messages and inbox messages that physicians receive is so much higher since 2020. And I'll look that up to see what the rate is, but it's like more than twice as much.
Of course it is. I think just the whole system is built towards that, and, how they're able to kind of manage that. And, besides as a non-physician, email has become, to some degree burdensome, and as many sort of filters and help and assistance that we have to kind of navigate it. You also know, the meaning and the impact of what's in there is becoming less and less.
Yes.
I actually have started using the phone again, just picking it up and calling people, because, I'm just...
It's pretty drastic.
I know. It's like, DEFCON here, around here.
Yeah. So according to an NYU Langone study, over the past 5 years, messages have increased by 153% in Epic.
Wow.
And that's uncompensated time. So they haven't actually accounted for that. That's huge.
Right.
And I'm glad that they are developing tools and really thinking about what to do about that, because some messages and some care doesn't need to be in office care, but there's always that painful period where you're like answering 8 billion emails and you have no life because it's your inbox. So,
yeah. The other story came up, which I thought was really great news and interesting, because it was Tampa General. So, we got lots of friends down there. But they showed how AI was saving lives built into their operating systems around sepsis detection. And, sepsis has been one of those things where we've seen, very early on seeing impact as we switched over to electronic health records. There was a lot of ways to kind of get in there, but it's still a huge problem in terms of deaths and mortality within the healthcare system. And this tool, which is powered by Palantir, so I think it's the Foundry tool implemented there, helps reduce early sepsis mortality by 68%. So huge numbers, huge impact. And then shorten sepsis stays by 30%, real significant numbers that they're seeing. And I think in terms of the projected savings was something around $40 million over 4 years. So, really exciting stuff. Also from a company we haven't heard too much about. Ironically, I've heard quite a bit in this last couple of weeks, had a conversation with Scott Rabin, who is down at Nebraska Medicine, also implemented Palantir in that. So I suspect with this story coming out, we'll see a little bit more of what they can do in the healthcare setting, but, big impact for sure.
Yeah, that's huge. Saving almost 900 patients' lives, and they're tracking lots of different data streams, bringing in lab results, clinician notes, bedside monitors, health records, and bringing those together. And I think that's something that we are going to see more of going forward. That's some of the potential of AI, to be able to predict outcomes, but also to be able to help us provide care before things are terrible. Right. So that's great news.
Yeah. And then we had one more.
All right, let's talk about more great things. OSF Healthcare. We love OSF. They move intelligent hospital rooms enterprise-wide. You know, sometimes they just do a pilot for something, but they are really going for it. So they announced on June 3rd that they're expanding their partnership with HelloCare.ai to deploy AI-assisted intelligent hospital rooms across their enterprise. So the platform integrates virtual nursing, virtual sitting, AI-assisted patient safety, digital whiteboards, digital room signs, and patient engagement into one inpatient care ecosystem. And nursing capacity is at its limit. And it would be great if the technology tools helped with the problems that they're facing, you know, patient communication and patient safety and care coordination. So that's not just a point solution. It's something that's meeting their needs at the point of care.
Yeah, no, that's a great one. I mean, we put these together. I didn't even think about it, but we really covered all the gamut in terms of the tools. We've got a virtual nursing tool. We've got a couple ambients in there. And then obviously the analytics piece of that. So, you know, really representative of all of the technologies our folks are talking about all the time, actually starting to give some really good data, good results. And then, of course, the UCLA story around actually looking at these tools and you know, assessing the validity of what's happening. And I imagine CMS will be doing some of that same work. So, you know, I think things are moving fast. I just heard a friend of mine interviewed Mel Robbins, and Mel Robbins said to the marketers in the room, you know, you might think things are going fast, but it's moving as slowly as it ever will moving forward. And it just sort of blew my mind. And I feel like that's where we are in terms of this implementation. And while we may feel exhausted, it is an exciting time to be a part of it. That's for sure.
Yes. And even though we didn't talk about menopause or GLP-1s, I do want to shout out to a female author, Rana Oddish, for once again being on the bestseller list with her second book, Aftershock.
Oh, fantastic.
We're moving faster than ever.
We are. One more good thing is that Assort Health announced today that they got $120 million Series C. I think it was led by Menlo Ventures. They are now their valuation is now $1.2 billion. Kind of amazing. I didn't know them that well. I've seen them a little bit recently. I think what they are. They're all about kind of the patient experience and the sort of patient journey in terms of that. Yes. They break it into kind of those four pieces in terms of inbound calls, concierge. They do referral loops. They're kind of working with the workflow behind the EHR, like referrals, patient intake, and then staff in terms of AI kind of managing complex patient access needs in real time.
Yes. So I think they listened to my complaints when I say what I really want from AI is for me to be able to call something in my health plan and get care without it being a total and absolute nightmare. That's all I'm asking for. And it turns out it's also a concern for healthcare providers, physicians, nurses, and within health systems. If you need care from like a specialist, that gap, like between where you get diagnosed or where you get, referred and getting the care, that's a huge pain point for healthcare delivery. So I love that something would be looking out for you because
Yeah. Have you watched?
we've all been referred to a specialist and then just not gone.
Did you watch their commercial? Because it definitely
I didn't.
spoke to the experience. Yes, I think I saw it on LinkedIn. But props to the team over there in terms of marketing or whoever did it. But Jeffrey Liu is the founder, co-CEO. But really, they kind of nailed the frustration points from the patient experience side for sure. So excited to see what comes of the investment. They have some notable investors, including Joe Montana and Quiet Capital and Tau Ventures. So lots of folks involved, lots of familiar names, and excited to see what comes of it.
Yes, and they can reach out to us so we can partner for our event in October, which is the 6th and 7th.
Well, folks, that is this month's 5 good things. The thread is pretty clear. The good news is not more AI. The good news is that digital health is starting to sound more operational and making more of an impact. So less magic, more admin relief, more infrastructure, more workflow improvements, and more attention to capacity, safety, sustainability, and measurable outcomes. The version that matters for CIOs is much more practical. Does it save time? Does it reduce risk? Does it support the workforce? And does it integrate into care? Thanks for listening. This is Megan Antonelli signing off.